the Heart About Equity. My name is Ashlei Rodgers. I'm the host of the show. And today I have an amazing guest. Her name is Katie Drasser. She's the CEO of rockhealth.org. Go ahead and introduce yourself, Katie.
Hi, Ashley. It's great to be here. I'm the CEO of rockhealth.org and a whole bunch of other things, and I'm excited to dive into the conversation with you.
Well, I'm happy to have you here too, because I know you are a very busy woman. So I know we'll just kind of like roll with the regular questions that we have, but I'll also have some other follow-up questions based on the work that y'all are doing at rockhealth.org. What does health equity mean to you?
I appreciate you starting there, right to the heart of the matter. There are so many definitions of this. I really appreciate the work that Robert Wood Johnson has done around sort of a fair and just opportunity. You also have the World Health Organization's definition around the absence of, unfair or avoidable differences among groups. All that I believe in. And I think it is like a baseline. It's a bare minimum. And so I really appreciate the work of folks like Dr. Lauren Powell and others who emphasize joy and thriving. But really from my experience, like aiming for the joy, aiming for the thriving is really like the next level, not just the baseline of what it means to be healthy. And I think even from there, we then look at like, what is innovation? And you often find me saying, it's not innovative if health equity isn't deeply embedded in it, right?
People don't understand, like, you're working for rockhealth.org right now, but you have a lot of experience. Like, you didn't just pop out and become a CEO. Like, you're pretty like well seasoned in the public health space. Like, you get it. Like, how do you have those conversations about inequality in the sector? And also, how are you, what's your method of shifting the power? Because that's something that I know you're really passionate about.
Oh God, there's so many ways to answer this, right?
Mm-hmm.
And so many ways for all of us to think about it. So I think one place to start is sort of like confronting your own privilege and power, right?
Mm-hmm.
So for myself, I am a white woman, I am heterosexual, I'm able-bodied, I am college educated, I have all of these privileges, right? And just being aware of what that has afforded me, even if things have been hard, even if I haven't always felt that privilege in a lot of spaces, because as you mentioned, I've had the privilege of navigating a lot of halls of power, being proximate to a lot of power, right? There's privilege in that. And then there's also ways in which that's really hard on the body, hard on the soul, to be so proximate to some of that power, right? And to kind of firsthand witness and receive some of the problems that come with power, right? But even so, right? So confronting our own racial identities, our whiteness, and other kinds of privileges we hold, that feels to me like step number one for anybody. And digging into that, interrogating it, and getting sort of like comfortable with acknowledging that often, daily. Right? In all kinds of ways. I think that's the first thing. The other thing is then like, okay, so in my case, I'm running an organization. I need to just for a moment, I have the best team in the world. My team is everything. I only hire people smarter than me. They are just fantastic. And so much of our good work is because of them. But then, right? So as an organization, how do we look at power? We have an aspiration to have collective leadership, shared power here. That's not default. We are designing against and building against default norms, default systems, norms, culture, et cetera. So one of the things we do is really look at, Tema Okun's work in white supremacy culture in organizations. Like, how does that show up? And so us being aware of that, right? So at an organizational level, it shows up with the primacy we put on urgency. It shows up in grind culture. It shows up in perfectionism, the written word. These then are all gatekeeping mechanisms for keeping people out. They're mechanisms within the organization for burning us all out, for doing work that can be harmful, right? So really like looking at those things, that starts to shift power, right? We then take that and go out in the world. And so how do we, how we work is one of the ways we shift power, but we got to do all that other stuff first, the individual, the org, and then out in the world, how we show up, our approach to work is not just bold and loud and kind of we're not always looking for the credit. We're looking to actually do good work and change the system. And so that sometimes means slowing down, working community. There's very few things we do here that aren't in collaboration with others. We absolutely need partnership. There's power in those partnerships. The work will be better. And that's part of the how, right? And so that sort of radical collaboration that we do, which isn't always like on our website. It's sort of like behind the scenes sometimes in how we advance what we're moving towards. But that's the beginning of the shifting of the power. There's sort of a whole bunch of other stuff around recognizing power over, power with, power to, and how we then use those kinds of power towards mission, towards purpose, right? And it's not all bad. It's just recognizing what's needed when, and then how we do that in a way that doesn't harm people, that actually sees the humanity in the individuals and the organizations we're collaborating with and the communities we intend to design with and for, right? So there's sort of so many ways to unpack that question. I think it's a lifelong journey and an organizational endeavor that will never be done. But that's the beginning. You asked, how do you start? Yeah. I think that's some of the work. And I won't go on and on because it's just the beginning, right?
But the fact that you're self-aware enough to even call out the structures and the systems, right? And like you get it, like you get it in your soul, and you can tell just by when you're talking about it. And that's why your staff is probably so happy to work with you, because it's top down.
You should ask them.
We'll ask them on the side, like, how you really like working there? No, it seems like
verify that. Yeah, no, just
they seem pretty happy. And so that's kind of going to roll into my next question in regards to rockhealth.org. Like, what are y'all really focused on? What are you trying to do for 2023 and beyond?
I love that. Okay, so for rockhealth.org for the next, we're in the middle of a 5-year strategy that's really looking to advance the space more and to be more equitable. We're doing that through 3 initiatives. One is our Equitable Investments Initiative, really looking at who's getting funding and for what. So how do we shift who's at the table? How do we shift the way the money flows? How do we create better collaborations in the investment space to better support innovators and their innovations? So Equitable Investments Initiative. The second is our Equitable Design Initiative, which is looking at experience design. It's looking at how we design new narratives in digital health to be more inclusive. It's looking at how we bring equity-centered principles to how we design in general, whether it's your business model, your product, your service, the way you work, et cetera. And then the third body of work is really around our convening and our community. And I feel so lucky to be a part of this community, of the community that surrounds Rock Health, that's been built for over a decade since our founding. It's just truly, truly folks that lead with head and heart, are deeply committed and want to kind of carry this shared purpose, like rockhealth.org. So all of our convenings, top 50 in digital health, where we celebrate the top 50 leaders in digital health, our CEO Summit to support startups and founders and CEOs, and then our Rock Health Summit every year. In addition to all the events we do around the country, where we get to hang out with folks in more local ecosystems. So investments, design, and convening are really the 3 kind of levers we're pushing and pulling on at the moment.
So can you tell us, I know there's a Rock Health Summit coming up. Like, can you tell us a little bit about that?
I think of it as like the heartbeat of the digital health community. It's people who are deeply committed. It's the leading lights in this space. It's folks who know that we need to be doing this work together if we're going to like go far, right? And so I think of like the community that comes to the Rock Health Summit and our collective imagination of like what's possible. Like, that's how I think of the Rock Health Summit. So September 27th, San Francisco. I'm in awe of the people who speak on our stage and the folks who show up. It really is like the tried and true. So it's a real privilege to be a part of standing that up with a whole bunch of partners and others.
That's amazing. I do have a follow-up question to that. For those who may not have the access or means to be able to participate in some of these events, is there like a sliding scale for those who may not come from organizations that don't have a lot of funds, but also have they would love to be able to partner with some of these people who are in these spaces?
Absolutely. We dramatically reduced the price of the Rock Health Summit ticket when I started to make it more accessible. We also created the fellowship. You get free access. So it's a democratized way to figure out who has access if you can't afford to be there. There's also a virtual component that is very accessible. So we've all of the Rock Health Summit is available virtually as well. And so there's a lot of different ways to engage that meet people where they're at.
I know you have the rockhealth.org Innovation Fellowship Program. Can you kind of tell us what that program's about? Like, I know y'all are really big on being intentional and not like performative, but really intentional about having women and people of color a part of the program and getting access.
Thanks. We love our fellowship. It's one of the many things we're doing to build towards a more equitable digital health field. And so through the fellowship, we're committed to supporting sort of intrepid leaders who are carrying out that kind of work. It's a year-long engagement to create opportunities for some of these leaders to gain more exposure, get more connected up in the industry, and engage with the Rock Health community. And it really represents a diverse range of perspectives, expertise, lived experiences. Right now, we have 66% of our fellows are women, 83% are folks of color. And all of them are committed to some sort of health equity innovation, some sort of company or endeavor that will really, with their success of their idea, will change the landscape. And I think, it makes me think about, the best thing I can do is share, like, for instance, who one of our fellows are. So like Eric Plebia is just, I love her. She's amazing. She's a clinical informatics expert and a tech entrepreneur, but she's also deeply rooted in communities that have been drastically affected by chronic diseases in poor and rural communities, et cetera. And so a few years ago, she founded, I don't know if you know her. Do you know her, Erica?
No, I don't know her, but I'm about to look up on LinkedIn.
Yeah, she's amazing. We'll connect you up. But she's now the founder and CEO of MedHall, and it's a early stage digital health company that enables safe, reliable, and efficient transportation to healthcare providers, clinical trial sponsors, ensuring adherence and visit completion, et cetera. But her lived experience is a competitive edge that's solving for systemic inequity with a viable business model. So she's just an example of like many of the folks we get to collaborate with and many of the fellows who are building something super valuable, grounded in lived experience, expertise, et cetera. Yeah.
Look, homegirl is smart. I'm definitely going to be Googling her to figure out what she's doing with her org and the other fellows too, because I got a chance to check out the website and there are some really impressive folks who are part of this program. What do you think, in your opinion, what can be changed to make sure that more folks of color and those from lived experiences have opportunities to receive the VC funding that's often is given to a particular type of group opposed to others?
Yeah. No, it's a really important topic. I mean, it makes me think of, I don't know if you're familiar with Felix Chene's work, but he talks about sort of equity, inclusion, radically includes marginalized communities as we think about our teams, our efforts, our design, money flows, et cetera. So when you think about VC, one of the starting points is who's at the table on both sides. Who are the LPs? Who are the VCs? Who are the teams that support the VCs? Who are the folks raising money? So one of the things we can all do is just interrogate the heck out of who we are sitting alongside of at all of these tables. We all have connections to some of these places of influence. And so how do we continue to push on radically changing who's sitting at these tables? That's one. That kind of gets to like the inclusion piece. There's another piece of this, which is around the health equity piece. It's a separate play. What is getting funded? Right? And how do we really think about how that funding is flowing to innovations that actually have equity-centered principles, right? That's a different play. If we do both these things, the field truly starts to change. Truly. Those two things alone, right? But how we do that, I think a lot of what I'm hearing from folks that we get to collaborate with is how? Yes to doing it, and how do we do it? And so some of the work we're doing right now at rockhealth.org is really looking at that integration piece, that implementation piece, because I do think there's a will. We don't need everyone to change. I mean, it'd be great if they did, but like there are so many leading lights that are moving on this already. And so how do we support those folks and a whole bunch of others to shift behaviors, to shift the way their teams look, to shift how they spot and source innovation. I'd point to our equitable investments initiative that's really looking to expand these activities. We put out a report called Reimagining Opportunity and Innovation in Digital Health that looked at like all the opportunity and innovation we're leaving on the table by not doing these things. And that work is continuing. And that work was built with a community of leaders that informed this through nearly 100 interviews, and then a team, a council, an advisory group, quite frankly, whose shoulders we were standing on, who already are the leading lights in this space, have published work, have researched this, have documented this. And so building off of their good work, this comes from some Rock Health investment data that we have. We know over the last year that almost over half the founders in digital health are women or identify as women.
Yeah.
13% of the dollars flow to them. So the average deal sizes are considerably less, almost half. And then the sheer number of dollars they're getting are so low, right? So we know there's an inequity there. It's not a pipeline problem. We have the founders. It's how are they getting the funding? How are they being seen? How are they being evaluated? If there were more women at the table, for instance, you could imagine the likelihood of those numbers going up is high. Not guaranteed, but it's high, right? And so again, going back to how do we shift who's sitting at the tables? And again, I'm seeing so much change in a good direction. We just have a lot of catching up to do, right?
Yeah, no, I think you're 100% right. If you have more women at the table and then also more people of color at the table, and the intersectionality of that would be a whole different ballgame. And so I ask
a range of lived experience, right? So like identity is one thing, lived experience is another. Like, how do we make sure that folks making decisions, like Erica Plybia, right? Like knows about chronic diseases in rural, poor communities. Like that's her competitive, one of her, also her like technical wisdom, which is outstanding, but like that's her, one of her competitive advantages. Imagine if she met a funder, an investor that also carried that and could see really quickly and move farther and faster than others on like, oh, there's an opportunity there because we know it in our bones, right? So,
and also I think that's, as we were talking about that, it's also access, right? Like being invited to the room or to the table to be able to have these kind of conversations with other funders is also a hurdle that a lot of people are trying to jump over right now as well. And I know your organization is trying to open those doors for those communities that necessarily don't always get invited to those tables. And so I wanted to ask you, like, for you as a CEO who's doing a lot of work and talking to a lot of people all the time, and I know you're a mom and you have a whole life, like a whole life. How are you practicing self-care to make sure you're whole as you're helping so many other people?
Yeah. Also not an expert on this. So just to start there, something I pay attention to is self-care is not, we can't self-care our way out of problematic systems. And I think sometimes we put too much pressure on ourselves to like self-care to remedy things that are far bigger than any one individual can like solve for in their life. Right. And so I'm careful with self-care that like, I think sometimes we can put a lot of pressure on ourselves to like solve that. Like, oh, we're not self-caring enough. Like, what are we doing for self-care? It's like, we're doing our best, in many ways. And like, I try not to have big goals around self-care because it starts to replicate what work feels like for me. Right. Like, so I try to just stay committed to rituals and practices, orientations, rather than sort of like end goals in my life. And just, I really make time for my community. I have a really vibrant group of friends and community with my kids. And so it's as important to me and more important to me than work. I think what I would say, and I wish I had learned this lesson earlier, and I see this with a lot of people, especially where you're a purpose-driven leader, is sort of not letting the work define you. And I think over time, one of the things I've learned is really defining my work, but not letting it define me. Because I'm defined by so many other things. And when I hold that psychology and those definitions, I just feel more like a full, whole human being, which feels pretty good, so.
I love it. I feel like that should be like on a card or something like that's like Brene Brown-esque vibes.
Oh, geez. Yeah.
It is though. It is like, it's true. I feel like a lot of times people feel like work, defines them. And when they no longer are doing said job, they lose themselves. And I appreciate you saying that because I think it's important for us to call that out. If you want to learn more about the amazing work that you're doing at rockhealth.org, how can they reach?
I appreciate you asking that question. So rockhealth.org, literally our name is our website. So go there. We're also on Twitter and LinkedIn. Those are good starting points. I would then point you to, we have a great insights piece around equitable design. Check that out, how you build more equitably in this space. Our new report on reimagining opportunity and innovation in this space. Our design work is led by Dr. Monique Smith. Our equitable investments work in that report was led by Deontay Wortham, two of my teammates who are just outstanding. And then checking out all of our convenings and our gatherings led by Jennifer Simmons on our teams. We've also been going around the country and doing smaller dinners and gatherings with innovation economies in places like Tulsa, Atlanta, New York, et cetera. And so looking to do more of that and looking to find more partners who want to gather all across the country.
Well, Katie, this has been such a great conversation. Thank you so much for being a part of the show. We'll make sure to include all the links below and also have people check out the summit when tickets go on sale. Thank you so much.
Thanks, Ashley. And thanks for all the work you and Katie and the team are doing for the Heart of Health Equity. It's super important work. And many of us are grateful to you for leading it. So thank you.
Oh, thank you. I'm like heart emoji.